My name is Maaike Conradus. I'm a technical physician at the 3D lab of Medisch Spectrum Twente. In the 3D lab, we help surgeons to prepare for their surgery. And this means that we print anatomical models on which they can prepare the surgery, but also to discuss the treatment option with their patients. The models are also used to pre-bend metal plates, which they use to fixate the bones during surgery. And furthermore, before the actual surgery takes place, we use the computer to digitally plan the procedure. So we plan where the surgeon should cut the bone to have an optimal fit, and we design the tools to do that. My research at the university was about vascular surgery, about stent grafts. These are devices that are implanted in the aorta when there's a dilation, and the stent graft is inserted in place so that we prevent rupture of the vessel wall, which is in most cases fatal for patients. The objective was to gain insight in what happens to these stent grafts once they are implanted in patients. Do they stay in place? Does the vessel dilate? How does the stent graft move during the heartbeat? Because it's not a static environment, it's a dynamic environment. So all these questions try to address, and we focused primarily on one type of stent graft. When I heard the news about the Overijssel PhD Award, I was working in the 3D lab. I felt super excited. Of course, I didn't expect this at all, so I felt very happy. We were running around in the 3D lab. During my PhD, to me it was most surprising to learn that the insights that we were gaining were very unique to both physicians and manufacturers, because insights about the devices in patients, implanted in patients, are just not there. And with the algorithms that we developed and the studies that are now ongoing, we can actually provide these insights. Well, I'm very proud to have been awarded the Overijssel PhD Award, and with this prize I would like to take the time and enjoy it with my family and my friends.